Welcome to the Pod of Inquiry, pushing the envelope for human understanding and optimization, the podcast for podiatrists. The Pod of Inquiry is designed to empower you with knowledge. What happens from there is up to you. Your host, Dr. Stephen Barrett, has designed this show to take you down some very deep rabbit holes, hopefully bringing you back out again, relatively unscathed, but cerebrally whipped, enabling a better understanding of all things worthy of inquiry. If you have more questions after the show, then that is good. The new discovery today many times was the new discovery 50 years ago, only to be suppressed or plainly ignored. Medicine and surgery can sometimes take a long while to get their paradigm shifted. We hope to have a lot of fun on this show and maybe destroy some ridiculous dogma along the journey. Thanks for joining the show today. Let's start spelunking.
In today's episode, I sit down with Dr. Hans van Wechem, a psychiatrist and psychotherapist from the Netherlands, to discuss the fascinating world of psychedelic treatments, specifically with psilocybin. Dr. van Wechem shares his personal journey with psychedelics, the legal status of various psychedelic substances in the Netherlands, and the potential benefits and risks associated with psychedelic-assisted therapy. Join us as we explore this cutting-edge research and application of psychedelics in mental health treatment. All right, good afternoon. I'm here with Dr. Hans van Wechem, and Hans, thank you so much for agreeing to come on. I think the audience is going to be very interested in our topic today. And that's going to be psychedelic treatment of different conditions and what you all are doing at your institute. So thanks for coming on the show.
Thank you for inviting me, Stephen. It's my pleasure.
So can you give the audience a little bit of background about what your practice is, how you got involved into the psychedelics, so that they can kind of understand where this conversation is going to come from today?
Yeah, well, my experience with psychedelics started about 10 years ago. A friend of mine was very active in the Netherlands working with ayahuasca. And I've been reading the books long time ago that got me on the track of being interested in what psychedelics are.
Right.
Then he asked me if I would have a good location in which he could invite a small group. And he was looking at my practice, and I've got a beautiful practice where you could easily do a group like that. And he said, would you be interested in joining? And I did not know where I was getting myself into.
Right.
And maybe for the better, otherwise I might have said no. And it was quite a challenge, Stephen. I think I spent hours not knowing what was happening to me and being all rational. I was fighting every minute of it. So it was quite a challenge. But I immediately recognized the potential, but also the potential dangers of working with psychedelics, and that it needed a bit more preparation than what I've got, and especially definitely more integration that was being provided. So I was left on my own wits, and it was quite a challenge to find my way back, but I was another person afterwards. So I can truly say it was my life before and after this experience that really, I think, really changed my life and the way I look at what the true essence of healing is.
So let me ask you, because there's a lot in what you just said. So your first experience personally with psychedelics was ayahuasca?
Yeah, that's correct.
And can you tell the audience what ayahuasca is? Because there's a lot of misconception about that particular.
Ayahuasca is a brew original from the Amazon, and it consists out of two plants, one of them being a Mayo inhibitor, capi, and a plant chacruna that contains high levels of DMT. And it's a mystery in itself that out of, I think, 150,000 different plant species, the Indians there knew how to combine these and how to prepare these hours of cooking and stuff to make this horrible brew. It tastes like really awful. And as I've understood it, was first being used in cleaning the digestive tracts from parasites in low dosages. So it makes you throw up and you diarrhea, so you clean the whole tract.
Right.
But on a higher dosage and a higher level, it's more of it purges, right? That's what it does. But also on a mental, emotional, spiritual level, it cleans you from what they see as parasites, stuff that cleans all to your energy system that need to be cleaned out.
Got you. Now you made a comment that you were a different person before this experience versus after. Can you just give a couple of points of illustration of that, how it changed you personally?
And first, I was all about rational explanations, so more scientific perspective of life. Because everything needed to make sense on a rational level. So it was more the everything I thought was about brain and about brain function.
Okay.
And afterwards, I realized and I experienced that maybe consciousness, as we know it, is not a product of the brain, but the brain sort of exists within consciousness. So you could say, is the brain the creator of consciousness or the receptor at the receiving end of consciousness? Like, is it a radio that transmits, or is it a device that picks up on something else? So it was turning it all around, so to speak. So it's my whole idea of what the nature of consciousness is. I think Rupert Spira, a philosopher, said consciousness is that in which everything appears. Consciousness is that with which everything is known. And consciousness is that out of which everything is made.
Okay.
And that was a really deep one. And that set me on the track of quantum physics and non-dual philosophy. So a whole new world opened to me.
Now, with ayahuasca, first of all, there's so much that could be talked about. You know, what I've read about how these guys in ancient times came up with this unbelievable chemical concoction that could get the agent through the gastrointestinal tract and everything. I mean, that's another shoot. Yeah. That's a huge discussion for some other time. Yeah. But after ayahuasca, then how did you get into looking at some of the other psychedelics?
Yeah, well, of course, my interest was already there, and I was wondering if other psychedelics might have other effects as well. And I was within the circles of friends that had a lot of experience, because as you know, in the Netherlands, there's always been a sort of liberal policy towards psilocybin, especially. It was legal, and up until not that long ago, ayahuasca was also legal in the Netherlands. It's been prohibited now.
Okay.
So I wanted to know more about the differences between ayahuasca, DMT, and psilocybin. And of course, I wanted to know about mescaline, San Pedro as well, because I wanted to know what the different effects of different psychedelics would be. And of course, the whole thing that's been starting in the Netherlands, but worldwide, with the three key players, MDMA, ketamine, and psilocybin, set me on the track of wanting to learn to work with those compounds in a responsible manner. Because it's always been done within the context of the ceremonial
Right.
context,
Right.
right? And
Right.
I wanted to build a bridge to the medical community as well.
So
yeah.
but before you started the ayahuasca, you had a traditional psychiatric practice. Is that correct? Okay.
Psychiatric and psychotherapeutical. I've been trained as a psychiatrist, but also as a psychotherapist, and especially as a bonding psychotherapist. And that's a specific methodology to work more with people with early attachment disorders. So that's more a bodily oriented form of therapy.
Now, when you were going through, let's take you before the ayahuasca experience, obviously, as clinicians, we will see conditions that we can get well or treat effectively very quickly. And then there's others that are just recalcitrant to almost anything we do. And then those pictures of those patients play through your mind because there's not much you can do for them. Then all of a sudden you have this experience and it's like, okay, maybe this could be implemented for this person and this person that I could. Did you find that before you started integrating the psychedelic component to your practice, that there were just these folks that weren't responding, but you were doing all of the right things, but then in conjunction with doing all of the right things, all of a sudden this experience then led you to something that obviously probably increased your efficacy in treating some of these difficult patients?
Yeah, well, of course, you can't call it treatment as such. And the Inspector of General Health in the Netherlands is paying close attention for me not crossing that line.
Okay.
Because it's, as you know, it's not evidence-based yet, right? There's a lot of research being done, but you can't call it treatment. So you have to be really careful which clients or patients you can include, because suggesting that it would be a effective evidence-based treatment would be crossing that line, and that put me in a difficult position, because I could easily lose my license. If one of the clients would file a complaint against me, there's nothing much I could say in my own defense, because from that point of view, I'm still considered to be a quack, right?
Yeah. Yeah. It's amazing how quackery turns out to be the fundamental reality in many, many cases, right? After a period of time, the medical history is replete with quote quackery that then becomes accepted mainstream practice. So when I was looking at your material on your website, it talks about you're using psilocybin truffles. And then am I misunderstanding that truffles are legal, but the actual mushroom itself is not legal?
No, you understand this correctly. I can't explain it to you. Well, there is this story about it that I think, late 80s, I think, or early 90s, the daughter of the French ambassador fell out of the window, supposedly under the influence of psychedelic mushrooms. That was quite of a thing within the political arena. And they decided to ban all the psychedelic mushrooms, and about 200 strands of those. They decided to ban them overnight. So all the mushrooms were being prohibited. But literally the stuff that's under the ground, stuff that they couldn't see, was being overlooked. So the mushrooms were being prohibited, but the mycelium, the truffles, which the mushrooms sprout from, were being overlooked, and they are still legal.
So the mycelium then actually makes a truffle like the truffles that we see in the Michelin star restaurants?
Well, there's another kind of truffles. I wouldn't recommend eating those truffles that I'm talking about in a Michelin star restaurant. You could have the trip of a lifetime, but it's not the truffles that I'm referring at.
But I mean, is it a similar type structure?
It's a fungi. And look at it as a sort of a nutty structure, and they're different in size and we use different strands, and they have all those exotic names like Mexicana and Atlantis, and the strongest strand being, of course, Hollandica.
Okay.
So that's the strongest strand or brand of truffles that are being used in the Netherlands. We use Mexicana because they are not that strong and have more. Well, they're more focused on the emotional ability to process emotions, and the stronger ones are more about visuals and hallucinations. So we want to be more focused on emotional processing than on the visual aspects of it.
Understood. But don't they have to have the mushrooms above the ground to get the truffles below the ground? I mean, I don't know anything about horticulture.
No, it's the other way around. You need the truffles to get the mushrooms.
Okay.
The truffles can do without the mushrooms in sense of their potency as a psychedelic.
So how does the potency of a truffle compare to the potency of a mushroom, Cap?
I think it's all about consistency. And I've met the guy in the Netherlands that grows those truffles. He's called Hans, like me. He's 84, and he looks the part in the sense of he's a bit of I don't know precisely the word in English, but we use the word kabouter. So he's more of an elfish guy. You can picture him into a fantasy movie where he lives underground, and well, he still really likes what he's doing, being 84. And he used to grow mushrooms until they were prohibited. But you say it's for the better of it, because the consistency of psilocybin within the truffles is better regulated than within the mushrooms, because you could have quite strong differences between one batch of mushrooms coming from the same truffles and another batch. But the truffles itself are quite consistent. And that's something that we checked, because I worked with Field Trip International. That was this large international organization, and they started working with truffles in the Netherlands because here it's legal. But we had to check every batch that we were using, and they were being tested. Really expensive procedure, but that's how we found out that every batch that we tested was really consistent.
Okay.
It was of really high quality as well. So truffles are more easy to work with because you have a stronger idea of how much, in fact, you are giving to your clients.
Well, I would imagine that one of the single most difficult things in any type of natural medicament or anything is ascertaining the level or the amount of the drug in that particular plant or material, because growing seasons can change. You know, the amount. I mean, you can see this in the wine industry where you'll have grapes on one side of the hill versus the other side of the hill, and they'll be totally different as far as all of their different characteristics. So I would imagine that would be one of the biggest problems, maybe with
because they've been grown under really controlled circumstances. It's not like you just in the open and fields. No, it's a sort of confined area where there are strict procedures in growing those truffles. And like I said, we've tested those batches for on end, and it was all really, really consistent. About 1/10 of the body weight of the truffles. So 30 grams of truffles were sort of equivalent to 30 milligrams of psilocybin.
No, what I meant was that the truffle is probably much more controlled and consistent dosage than something that's growing above the ground because of the different environment. So what other psychedelics are legal in the Netherlands?
No, well, it can be there's a short list. It's it's psilocybin containing truffles, and it's psilocybin containing truffles.
Okay. So there's no integration of some of the others that may be
No.
more specific?
Yeah,
So,
well, you could think of ketamine being also some sort of psychedelic,
right,
especially in high dosages. It acts like a psychedelic.
right.
And ketamine in itself is legal in the Netherlands, and for being used for therapy-resistant depression, it's being used under strict conditions within an academic environment. But yeah, they don't use it as a psychedelic. But like I said, in higher dosages, it will act like a psychedelic.
Right. Well, we've got ketamine that's legal here. I actually use ketamine on almost every operative case that I do, just because of the perioperative benefits of ketamine. And, there's a lot of ketamine infusion clinics. But what I was thinking about in the Netherlands, because I don't know the laws, and you are much more progressive than most every other country in the world when it comes to this aspect. But I guess that leads into my next question, is that when you do research on the psychedelics, you'll see that, DMT is great for dissolving ego, and MDMA is more of an entheogen. And, so you have these, just like with anything in the pharmaceutical world, you have a condition and then a drug that's indicated for that condition. But when you only have one drug and you have multiple conditions, now you have to kind of figure out, how does it plug into these different things? So, I mean, it looks like with the truffles, you guys are very good in dealing with depression, anxiety, even PTSD. Is that fair, or is that a poor estimate on my part, because I just don't know enough?
Yeah, well, I think the whole research, of course, is always within the context of symptom reduction, right?
Mm-hmm.
That's how we classify our whole psychiatric system with the DSM classification. And I think what's interesting about psychedelics is they go a layer deeper. So it's not all about the symptoms, but more where they are coming from. And there's this common denominator. It's got everything to do with a lack of safety within the system.
A lack of what?
Safety.
Okay.
Being safe.
Okay.
What I always say is a post-traumatic stress disorder. It's blocked survival energy. When you get traumatized and you can act accordingly, in nature, animals can allow themselves to develop a post-traumatic stress disorder because they will be helpless in a way. And then your survival will go steeply down. So for me, a post-traumatic stress disorder is survival energy. That's the strongest energy there is, the energy to keep you alive, that has to be blocked in order to survive. So when you want to run and you want to fight, but you have to keep still, then you're building up all these energies within you that want to act out. At the same time, you have to suppress all those energies. Like one foot, you're pushing the gas, and at one same time, you're pushing the brake at the same time. So you're spending all that energy, but there is no movement. And there's a lot of wear and tear in the engine. So you can understand the metaphor, right?
Correct.
And when this continues, and when this is out of context, and then we call it a PTSD, when you're hypervigilant and you're on your guard and you act and sometimes violently, but you are in a context where there's threat and the danger of being attacked all of the time, then you would not call that a PTSD. You would call that appropriate behavior. So it's also really contextual. So when you talk about the treatment of psychiatric disorders, then we're talking about container concepts, because depression for you might be something quite different than depression would be for me. So it's really subjective, as same goes for anxiety disorders. There are all general concepts. And what psychedelics do is they might confront you what is underlying this in the first place. So the effect might be because you are more connected to yourself and you have the experience that you have been present at the same time and being exposed to the inner trauma and being able to connect and reconnect, that the body will respond in a way that alleviates those symptoms, because there's no need for the symptoms to make you, because that's the function of symptoms, isn't it? There are signals to make you aware that something needs to be done, like pain, like anxiety, like depression. It's all pointing to yourself, like, wake up.
Right.
I need you. In the sense, I need myself. So it's all about reconnecting to parts in yourself that were being left alone without help. And that's where the metaphor of, as you understand, of working with inner child part, of internal family systems, all the methodology that's being used. But it's not strictly about symptom reduction. It's way bigger than that.
I'm sorry to interrupt, but before you continue with this great conversation, we need to take a quick break to acknowledge this week's sponsor.
I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called STEM Regen, which I take daily and genuinely believe could revolutionize your health journey as well. STEM Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. STEM Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once released into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating STEM Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that STEM Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co and use the code SBPOD to get a 15% discount off your first order of STEM Regen. So let me see if I can repeat that in words that I understand, because I have no, real foundation in psychiatry or anything like that. But what you're saying is that the psychedelic agent kind of reboots the whole inner system so that you can deal with these things better, and then they're not as symptomatic as they were before, because now you're more robust in your ability to mentally handle these things. Is that a fair way to put it?
I think you're putting it into the right words. And I think it's all about reconnecting. It's all about, that's where the neuroplasticity, the whole concept of neuroplasticity comes in. Like you forming or reforming all those broken contacts due to trauma and that it's in a way rebuilding itself in a way that, well, enables you to heal.
So I don't want to use the word treatment. So let's say when you give someone an agent that has these types of abilities to change neuroplasticity, to upregulate certain neurotransmitters and downregulate others, and basically rewire the default mode network, all of these different things. You're giving this agent, and I think it's unlike a lot of ways that are treated in regular medicine. If you have pain, you take an anti-inflammatory or an opioid, and you're maybe good while that mechanism or that agent is actually functioning. But once the half-life wears off of that, let's say it's an opiate and you have a very severe pain crisis, then the patient's still going to be in pain and they need another dosage of that. Whereas with the psychedelic agent, it appears to have more latency because it's tuning up the machine so that the machine can run better for a longer period of time. Is that a fair way to put it?
You could say it's rewiring. So it's really something else.
Right.
When you talk about symptom reduction, that is what you do. You suppress it. You suppress stuff by blocking it. And what psychedelics do is there are catalysts in rebuilding. And that's something completely different.
But that has more latency to it than just an agent that you're giving like a antihypertensive, that as soon as that drug wears out, then the blood pressure comes back up again. This is, I don't want to use the wrong words because I don't want to get anybody in trouble, but it's latency is due to the fact that it's rewiring things or improving the wiring, and that has an effect longer than the period of time that the agent is in the body.
Correct. What I always say, and that maybe sound a bit provocative, I think medication in itself isn't treatment. It enables treatment. You still have to do the work. You can help people lower their blood sugar level on so many ways.
Right.
But they have to adapt their lifestyle as well. That's where the trouble starts, because people want a quick fix. So I don't suffer my symptoms anymore. That's good enough for me. And if I have to up the dose to do this, I will do so. And gradually they start paying the price, and the body as well, of using all these external compounds to keep on suppressing symptoms. But as long as you don't, on a more structural level, work on restoration and on healing, you have to continue to feed people, get people medication. And if you call it treatment, you're giving, in a way, the wrong signal, right?
Right.
You should be helping people to help themselves to, in a more structural way, make the changes that are needed to become more healthy.
So an analogy to this in general medicine would be the patient that comes in with the gout, and we run a blood study on them and their uric acid level is really high. And so we put them on allopurinol or some other colchicine or whatever, but we never look at why is that uric acid level high to begin with, right?
Yeah.
And so the
Stop
treatment...
drinking red wine. Stop eating meat all the time.
Right. Or maybe too much fructose, right? And, because it's a proxy for, uric acid is a proxy for fructose. But anyhow, long story short is that we're treating a symptom, but we're not treating the vessel that's causing that symptom to come up. And that's what I think you're trying to emphasize here, is that this is a process that has to be combined with other foundational improvements in that individual human in order to attain the best benefit. And that leads into my next question about set and setting, because I think you lay it out on your website very well, that this is not a magic pill. This is one step in the overall process of trying to make this patient more mentally healthy. And then there's additional factors when you talk about set and setting, that if you don't have the right set and setting, you're probably not going to get a good response, or could get a horrible response. So you want to talk about that a little bit, because you talk about different things, and it looks like you're trying to stack things, like you look into connected breathing with holotropic breath work and some of these things. So let's talk about like that, because that's why, I think the United States is in a pretty big struggle right now. They know the benefits or the potential benefits for this, but they want to make sure that it's integrated properly. It's not just something you go down to your pharmacy and, okay, I got my little bag of mushroom powder today, and I'm going to go home. Yeah. And that's the last way to go about this. So tell us your process on that, because I think it's really fascinating.
When you talk about set and setting, you're talking about mindset. So that where it starts, and when people approach us, I'd say, okay, let's make an appointment for an extensive screening and an interview. And both with my colleague, so more psychotherapeutical oriented, and me from a more medical psychiatric point of view, to see if people meet the criteria. So we use the official in and exclusion criteria, and of course people had a psychotic episode or are directly related to someone who has had a psychotic episode. We say, statistically you have an elevated chance, up to 15%, that you might experience a psychotic break yourself. So I don't think that's a good idea if we wanting to have a psychedelic experience that will increase that risk. But at the same time, and of course, the somatic, the physiological criteria are being addressed as well. When you suffer from epilepsy or any other medical conditions that could get you in acute difficulty, that's difficult enough as it is, but you don't want to get yourself in trouble whilst under the influence of a psychedelic, right? So those people are excluded as well. And when we started out, we had to exclude quite a number of people because they had all the wrong expectations. They said this is 20 years of therapy in one session, so let's do it. So the mindset is also about, is someone emotionally mature enough to be able to integrate whatever information comes up. Because it can be quite a lot, and it can also be quite overwhelming. So if you're not mature enough, you have to block it out again. So the price that you might pay is that it will deregulate you, and you could be worse off, even worse than you started. So mindset is crucial. People have to be, in a way, healthy enough to deal with what might come up. And the setting is all about creating a safe space, because we know changes can only happen when people allow themselves to surrender. Because the moment you still are fighting it, it will be a battle over control. And it can get really dark if you fight it all the way, because the miracles happens the moment that you surrender to it. And for that to happen, it needs to feel completely safe. So that's why we're emphasized the necessity of having this bond and this personal alignment prior to people joining the program. That's the start of it. So that's the preparation.
Right.
And during, there is intense guidance or facilitation. Maybe that's more appropriate. So really being present. And when people started out holding the space, I thought, holding the space, what does it mean? I couldn't quite get it right. But I do understand now what they are meaning, because you have to be present and really attuned to the people that are doing the work. So, and it requires another skill set than you are being trained as a classical psychotherapist or psychiatrist, because we are really directive and really symptom oriented. This is about creating a safe presence. This during and afterwards, then it's all about integration. And that's where connected breathing comes in.
Okay.
Holotropic breathing is coined by Stanislav Grof.
Right.
So he's an icon, I believe. So
Right.
I use the word connected breathing to be respectful towards what he has done in this line of work. And we use this specific form of therapy that I've been trained in, the bonding psychotherapy, that's all about recognizing and expressing and connecting to your suppressed emotions. So you don't have to continue to suppress them, but it's more a cathartic way of letting go.
It's kind of like draining an emotional abscess.
Precisely. Those are the metaphors that I use all of the time, Stevie.
And
that metaphor, it is an abscess. Trauma, psychotrauma is as real as physical trauma. And it can leave scars, and it can leave emotional abscesses that drain away your energy. And like you have this fever, the febrile ondulants, the peaks in fever that people don't know where it's coming from when they have an abscess.
Right.
Like this breakthrough in panic attacks, people don't know where it's coming from. It's coming from an emotional absence.
That's a very good way to envision it, because it makes a lot of sense. As soon as you drain that abscess, your body plus an antibiotic can rapidly cure it.
Right. And the other being an antidepressant to prevent you from having a sepsis, so to speak.
Exactly. So now, when you're preparing people, let's call that the set, right? We're getting them ready for this experience. Are you using connective breathing or anything like that before, or is that more just after in the integration?
Yeah.
Okay.
A lot of my colleagues use it prior to the psychedelic experience. And there are arguments to do so. We found it to be more effective after the psychedelic experience, because it really helps the body to integrate. And sometimes people revisit stuff from the day before, during connected breathing, because there is a psychedelic component to that as well. Simply the breath work, trance is being used for thousands of years for changing your state of, in all the states of consciousness, as we know.
Right.
No, we use a more therapeutical way of reconnecting to inner parts. And that's a specific method using stacking dolls that represent younger parts in yourself. The ETI method, as we call it.
Right. I saw that on your website. And so I guess one of my questions is that in the preparation process, the set part of the deal, if the patient or client has such a deep repression that they can hardly even remember it, although it's constantly tormenting them from a subconscious level, if they don't even know it's there, how do you get them to that spot to be receptive to the experience of the psychedelic? Or is it just hopefully it opens that up?
Yeah, that's something that can happen. So that's why I always say that psychedelics are really unpredictable, because it can open up stuff that you weren't even aware of that existed in your body.
Right.
And it can be overwhelming. And that's, if you're not prepared in a good way and don't feel there's any guidance, it can be quite overwhelming. And that's what people can call a bad trip, right? That you are panicky and that you don't know what's happening and that you think that you're losing your mind or that you're dying. In fact, that you have this deep panic attack and the sense that no one is there to pull you out of it, right?
Right.
I say a bad trip only becomes a bad trip in hindsight. That's when you connect all the wrong conclusions to what it was that you experienced. So people coming out of psychedelic experiences and saying, well, I know how it works now because we are being governed by reptilians and they've taken over everyone, including the people around me. And then you could say, well, they've changed one narrative into another one, and this new one is not particularly helpful in being more at ease and at peace with yourself. So that's how important it is that people are being helped to integrate and to talk about and to share their experiences in a group. So there is this reality check right there. So that's really helpful. And that's what we are. We are social beings. We are used to tribal communication in that sense. So I think offering group sessions is something that is primarily there in our system.
That's very interesting. But I want to go back to something you just said, because I think I hadn't really made the connection about a bad trip and post-experience integration. But what you're saying is that a person may have or could have a, let's say, less than euphoric experience, and you know, and without the expertise of your team or someone equivalent to your team, it's just going to be that. It's going to be like, oh, wow, this was really a bad thing, because they might not be able to connect the dots, so to speak. But with proper integration, you can maybe take that experience that wasn't maybe so warm and comfortable and allow that to be integrated in a way that all of a sudden becomes still therapeutic.
Right.
Yeah.
So that's why I feel it needs to be a part of a prolonged process. And not everyone needs it to the same extent.
Right.
Because when you're stepping in and life is sort of all right and you're looking for more depth, and then it's more about personal growth and development, right? So, and when people are integrated within a loving system and a loving family, they get the support they need from their own surroundings. But when we're talking about potential use with psychiatric patients and severely traumatized people, they need to be embedded within this structure that will continue the work and well, especially the impulse that a psychedelic experience in itself might give to that process.
I know we're under a time constraint, but before we have to jump off, can you tell people about your institute, how they can get a hold of you, and where they can find all of this information on the website? And I think that'd be very...
as you said, we have a website, and that's, I think, easy, accessible to people.
Right.
The name of the institute is Experiential, not experimental, but experiential, based on experience, Training Institute. And we call ourselves an Experiential Training Institute because our aim and our focus is also on training professionals, mental health professionals, in learning to work responsibly with such a powerful compound and agent as, in this case, psilocybin is. And besides, we also work with highly motivated people that want to work on themselves. And as long as we can't call it a evidence-based treatment, it's all about guidance. And those people want to work on themselves in order to deepen their connection for personal growth and development, like I said. And of course, people with anxiety and mood problems are there as well, because I feel those are general things that we all do encounter. It's not that we are all emotional flatliners and we don't suffer from our own moods and anxiety levels every now and then. But, well, and there's a growing interest. And we experience that people do feel safe knowing that there is a lot of expertise and highly trained professionals there that have experience with people, that have been traumatized in their lives. So that's what we do.
Very
and
good.
hopefully building a bridge toward it being more accepted as a mainstream form therapy. And as we speak right now, there's an important discussion going on between the organization MAPS, founder of the MDMA assisted therapy, and the FDA. And hopefully the FDA is going to approve on MDMA being seen as medicine instead of a illegal street drug.
Right. Oh, well, Dr. Wechem, thank you so much for coming on today. Really appreciate it. I'll put the website link in our show notes so people can reach out to your institute. And I look forward to learning more from you in the future. Thank you so much.
Oh, thank you, Stephen, for inviting me.
Having neuropathy pain? Get relief at U.S. neuropathy centers. If you're suffering from neuropathy symptoms like numbness, tingling, or burning pain in your feet, you're not alone. Over 20 million Americans are impacted by this condition. At U.S. neuropathy centers, we specialize in using cutting-edge, non-surgical and surgical treatments to reduce neuropathy pain and restore nerve function. Our protocols combine metabolic support, neurovascular therapy, and regenerative medicine, an approach that gets results many times when others fail. Don't let neuropathy keep you from living your best life. Take the first step and call U.S. Neuropathy Centers today. 404-228-9892 or visit our website at nervetx.com.
I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.